My patient today is a 36-year-old Caucasian female who came in because she took herself off of her antipsychotics and realizes that she needs them. She is here for a 6-month follow-up but has been off of her medications for approximately 3 months at this time. She is currently presenting with anxiety as well as having increased sweating, racing thoughts, and hand tremors. And she has had a recent loss in her family. She denies any kind of ideas of reference or paranoid thoughts and behaviors, but she says that her family has noticed a change in her since she went off of her dosing of Vraylar. The patient has had an interrupted sleep pattern as well as interrupted appetite. She has decreased her meals to about 2 meals a day, sleeping for about 4 to 6 hours per night, and she usually sleeps 7 to 8 hours per night. Her current medications are lamotrigine 300 milligrams daily, metoprolol 37.5 milligrams twice a day, trazodone 0.5 tablets PO nightly as needed, 50 milligram tablets for sleep, Buspar 5 milligrams 3 times daily, and we are going to start her back on her Vraylar 1.5 milligrams PO daily. She took herself off of her Vraylar due to excessive weight gain. Patient endorses compliance with her medications. She is allergic to penicillin. Patient endorses a childhood asthma diagnosis as well as having tachycardia. She is medicated and cardiology follows her medication for her tachycardia. Currently denies any kind of racing or racing heart or any arrhythmia feeling. Her past psychiatric history: patient has been hospitalized 2 times into an inpatient program for her bipolar disorder. At the time, she was bipolar manic and was having suicidal ideation as well as suicidal attempts. She endorses that she has had 10 to 12 suicidal attempts, and the last was occurring at the age of 21. She has not been hospitalized since she was at 21 years or younger, and she did have self-injury of cutting and burning, the last occurrence at age 16. She denies that she is currently in psychotherapy, although she has had multiple psychotherapists throughout grade and high school. She has not been to psychotherapy in the past 5 years. She endorses a past psychiatric family history of her mother, biological brother, and biological sister all having bipolar disorder. She does not know her father's medical or psychiatric history. Her mother has a medical history of diabetes and hypertension. Patient endorses cigarettes 1 pack per day, alcohol 1 to 2 drinks per night, and caffeine 1 drink per day. She denies any other illicit drug use. She denies any kind of history of rehab. She also endorses living with divorced parents throughout her childhood who did have a tumultuous relationship, as well as being exposed to trauma through her mom's psychiatric disorders. She is single but currently engaged with her fiance. She lives with her fiance as well as 3 cats. She has a social support in her siblings as well as her fiance, and she does enjoy reading and watching movies. Her highest level of education is graduating from high school and cosmetology school, and she is currently employed at Veda Institute teaching cosmetology. She presents today appropriate, well-groomed, and dressed appropriately for the weather. She is euthymic, alert, and oriented ×4. Her movement and motor activity is normal active. Her speech is normal speed, normal tone, and normal amount. Her mood is anxious. She does present as with an anxious affect, but she is appropriate. She denies suicidal intent, homicidal intent, or intent to harm herself. She does describe obsessive and racing thoughts currently. She is having non-command auditory hallucinations, visual hallucinations, as well as paranoid thoughts. She has immediate memory. Her insight and judgment are both fair. She has a blood pressure of 129/84 today, as well as a pulse of 99. Her weight is 79.4 kilograms. Her height is 5'7". I reviewed her labs from December 2025, and her hemoglobin A1C and lipid panel were within normal limits. Today, she is diagnosed with bipolar 1 disorder and performance anxiety. Her differential diagnosis is bipolar disorder 2, as well as social anxiety disorder and generalized anxiety disorder. Patient agrees to reinitiate Vraylar and was educated on weight gain and metabolic effects, tardive dyskinesia, movement, and NMS symptoms to watch for. Patient was concerned with her weight gain and plans to see a weight loss center for possible initiation of GLP-1s. She was educated on the risk of stimulants for weight loss. She appears to be responding well to her anxiety treatment, but feels like her antipsychotic will help her better manage her anxiety. There are no diagnostics needed at this time. Patient was educated with regarding her medication and treatment plan. Patient is aware of emergency services, including psychiatric ED and mobile crisis. Patient is fully aware to contact outpatient mental health services for any changes in symptoms or medication adjustments and development of side effects, or if she was in crisis. We encourage this patient to seek outpatient psychotherapy, as well as we will continue cardiology interprofessional care. Client denies any cultural considerations, and she will be following up in 2 to 4 weeks for further evaluation of medication.